Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The mother asked the nurse why her child's hemoglobin was normal at birth, but now the child has S hemoglobin. Which of the following responses by the nurse is appropriate? 1. The placenta bars passage of the hemoglobin S from the mother to the fetus. 2. The red bone marrow does not begin to produce hemoglobin S until several months after birth. 3. Antibodies transmitted from you to the fetus provide the newborn with temporary immunity. 4. The newborn has a high concentration of fetal hemoglobin in the blood for some time after birth. The correct answer is 4. Sickle cell disease is an inherited disease that is present at birth. However, 60% to 80% of a newborn's hemoglobin is fetal hemoglobin, which has a structure different from that of hemoglobin S or hemoglobin A. Sickle cell symptoms usually occur about 4 months after birth, when hemoglobin S begins to replace the fetal hemoglobin. The gene for sickle cell disease is transmitted at the time of conception, not passed to the placenta. Some hemoglobin S is produced by the fetus near term. The fetus produces all its own hemoglobin from the earliest production in the first trimester. Passive immunity conferred by maternal antibodies is not related to sickle cell disease, but this transmission of antibodies is important to protect the infant from various infections during early infancy. The nurse is teaching the parents of a child with sickle cell disease. To instruct them on how to prevent sickle cell crisis, she should include which instruction? 1. Restrict the child's fluid intake to less than 1 quart per day. 2. Drink at least 2 quarts of fluids per day. 3. Stay away from other teenagers. 4. Avoid physical activity. The correct answer is 2. Increasing fluid intake and being well hydrated will help prevent cell stasis in the small vessels. Restricting fluids causes stasis of red blood cells and promotes obstruction and increases the chance of sickling with hypoxia and pain to the part that is involved. Clients with sickle cell disease should stay away from others who have infections. When the spleen of a client who has sickle cell disease has become fibrotic and non-functional, the client is more susceptible to infections. Clients with sickle cell disease should not avoid physical activity as long as the client stays well hydrated. Which of the following should the nurse include when completing discharge instructions to the parents of a 12-month-old child diagnosed with Kawasaki disease and being discharged home? 1. Offer the child extra fluids every 2 hours for 2 weeks. 2. Take the child's temperature daily for several days. 3. Check the child's blood pressure daily until the follow-up appointment. 4. Call the primary healthcare provider if the irritability lasts for 2 more weeks. The correct answer is 2. The child's temperature should be taken daily for several days after discharge because recurrent fever may develop. Offering the child fluids every 2 hours is not necessary. Doing so increases the child's risk for CHF. Checking the child's blood pressure at home usually is not included as part of the discharge instructions because by the time of discharge, the child is considered stable and the risk for cardiac problems is minimal. Most children with KD recover fully. Irritability may last for 2 months after discharge. A child with Kawasaki disease is receiving low-dose aspirin. The mother calls a clinic and states that the child has been exposed to influenza. Which recommendations should the nurse make? Select all that apply. 1. Increase fluid intake. 2. Stop the aspirin. 3. Keep the child home from school. 4. Watch for fever. 5. Weigh the child daily. The correct answers are 2 and 4. Aspirin needs to be stopped because of its possible link to Rice syndrome. Additionally, the parents need to watch for signs and symptoms of influenza. Children with influenza, frequently present with fever, cold symptoms, and gastrointestinal symptoms. Increasing the child's fluid intake and weighing the child daily are not needed at this time because the child is not ill. Keeping the child home from school is not necessary because the child is not ill and has already been exposed. Which of following should the nurse perform to help alleviate a child's joint pain associated with rheumatic fever? 1. Maintaining the joints in an extended position. 2. Applying gentle traction to the child's affected joints. 3. Supporting proper alignment with rolled pillows. 4. Using a bed cradle to avoid the weight of bed linens on joints. The correct answer is 4. For a child with arthritis associated with rheumatic fever, the joints are usually so tender that even the weight of bed linens can cause pain. Use of a bed cradle is recommended to help remove the weight of the linens on painful joints. Joints need to be maintained in good alignment, not positioned in extension, to ensure that they remain functional. Applying gentle traction to the joints is not recommended because traction is usually used to relieve muscle spasms, not typically associated with rheumatic fever. Supporting the body in good alignment and changing the client's position are recommended, but these measures are not likely to relieve pain. Which of the following initial physical findings indicate the development of carditis in a child with rheumatic fever? 1. Heart murmur. 2. Low blood pressure. 3. Irregular pulse. 4. Anterior chest wall pain. The correct answer is 1. In rheumatic fever, the connective tissue of the heart becomes inflamed, leading to carditis. The most common signs of carditis are heart murmurs, tachycardia during rest, cardiac enlargement, and changes in the electrical conductivity of the heart. Heart murmurs are present in about 75% of all clients during the first week of carditis, and in 85% of clients by the third week. Signs of carditis do not include hypotension or chest pain. The client may have a rapid pulse, but it is usually not irregular. A 12-year-old with rheumatic fever has a history of long-term aspirin use, which statement by the client indicates that the nurse should notify the healthcare provider. 1. I hear ringing in my ears. 2. I put lotion on my itchy skin. 3. My stomach hurts after I take that medicine. 4. These pills make me cough. The correct answer is 1. Tinnitus is an adverse effect of prolonged aspirin therapy, and the child should be examined by a healthcare provider for hearing loss. Itchy skin commonly accompanies a rash associated with rheumatic fever, and the nurse can encourage lotion use. The nurse teaches clients to take aspirin with food or milk to avoid abdominal discomfort. The nurse can also address the fact that coughing after ingesting aspirin can be caused by inadequate fluid intake during administration. The nurse is caring for a client who has asthma. The nurse should conduct a focus assessment to detect which of the following? 1. Increased forced expiratory volume. 2. Normal breath sounds. 3. Inspiratory and expiratory wheezing. 4. Morning headaches. The correct answer is 3. The hallmark signs of asthma are chest tightness, audible wheezing, and coughing. Inspiratory and expiratory wheezing is the result of bronchoconstriction. Even between exacerbations, there may be some soft wheezing, so a finding of normal breath sounds will be expected in the absence of asthma. The expected finding is decreased forced expiratory volume due to bronchoconstriction. Morning headaches are found in more advanced cases of COPD signal nocturnal hypercapnia or hypoxemia. Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? 1. Cough productive of yellow sputum. 2. Bilateral expiratory wheezing. 3. Chest tightness. 4. Respiratory rate of 30 breaths per minute. The correct answer is 1. A cough productive of yellow sputum is the most likely indicator of a respiratory infection. The other signs and symptoms, wheezing, chest tightness, and increased respiratory rate, are all findings associated with an asthma attack and do not necessarily mean an infection is present. Which of the following health promotion activities should the nurse include in the discharge teaching plan for a client with asthma? 1. Incorporate physical exercise as tolerated into the daily routine. 2. Monitor peak flow numbers after meals and at bedtime. 3. Eliminate stressors in the work and home environment. 4. Use sedatives to ensure uninterrupted sleep at night. The correct answer is 1. Physical exercise is beneficial and should be incorporated as tolerated into the client's schedule. Peak flow numbers should be monitored daily, usually in the morning. Peak flow does not need to be monitored after each meal. Stressors in the client's life should be modified but cannot be totally eliminated. although adequate sleep is important. It is not recommended that sedatives be routinely taken to induce sleep. A nurse is teaching a client to use a metered dose inhaler to administer bronchodilator medication. Indicate the correct order of the steps the client should take to use the MDI appropriately. 1. Shake the inhaler immediately before use. 2. Hold breath for 5 to 10 seconds and then exhale. 3. Activate the MDI on inhalation. 4. Breathe out through the mouth. The correct order is 1, 4, 3, and 2. When using inhalers, clients should first shake the inhaler to activate the MDI, and then breathe out through the mouth. Next, the client should activate the MDI while inhaling, hold the breath for 5 to 10 seconds, and then exhale normally. A client is prescribed metoprolol via a metered dose inhaler, 2 puffs every 4 hours. The nurse instructs the client to report adverse effects. Which of the following are potential adverse effects of metoprolol? 1. Irregular heartbeat. 2. Constipation. 3. Pedal edema. 4. Decreased pulse rate. The correct answer is 1. Irregular heartbeat should be reported promptly to the care provider. Metoprolol may cause irregular heartbeat, tachycardia, or inguinal pain because of its adrenergic effect on beta-adrenergic receptors in the heart. It is not recommended for use in clients with known cardiac disorders. Metoprolol does not cause constipation, pedal edema, or bradycardia. A client with acute asthma is prescribed short-term corticosteroid therapy. Which is the expected outcome for the use of steroids in clients with asthma? 1. Promote bronchodilation. 2. Act as an expectorant. 3. Have an anti-inflammatory effect. 4. Prevent development of respiratory infections. The correct answer is 3. Corticosteroids have an anti-inflammatory effect and act to decrease edema in the bronchial airways and decrease mucus secretion. Corticosteroids do not have a bronchodilator effect, act as expectorants, or prevent respiratory infections. A 34-year-old female with a history of asthma is admitted to the emergency department. The nurse notes that the client is dyspneic, with a respiratory rate of 35 breaths per minute, nasal flaring, and use of accessory muscles. Auscultation of the lung fields reveals greatly diminished breath sounds. Based on these findings, which action should the nurse take to initiate care of the client? 1. Initiate oxygen therapy as prescribed and reassess the client in 10 minutes. 2. Draw blood for an arterial blood gas. 3. Encourage the client to relax and breathe slowly through the mouth. 4. Administer bronchodilators as prescribed. The correct answer is 4. In an acute asthma attack, diminished or absent breath sounds can be an ominous sign indicating lack of air movement in the lungs and impending respiratory failure. The client requires immediate intervention with inhaled bronchodilators, IV corticosteroids, and possibly IV theophylline. Administering oxygen and reassessing the client 10 minutes later would delay needed medical intervention, as withdrawing blood for an arterial blood gas analysis. It would be futile to encourage the client to relax and breathe slowly without providing the necessary pharmacologic intervention. The nurse is planning to teach a client with chronic obstructive pulmonary disease how to cough effectively. Which of the following instructions should be included? 1. Take a deep abdominal breath, bend forward, and cough 3 or 4 times on exhalation. 2. Lie flat on the back, splint the thorax, take 2 deep breaths, and cough. 3. Take several rapid, shallow breaths and then cough forcefully. 4. Assume a side-lying position, extend the arm over the head, and alternate deep breathing with coughing. The correct answer is 1. The goal of effective coughing is to conserve energy, facilitate removal of secretions, and minimize airway collapse. The client should assume a sitting position with feet on the floor if possible. The client should bend forward slightly and, using pursed lip breathing, exhale. After resuming an upright position, the client should use abdominal breathing to slowly and deeply inhale. After repeating this process 3 or 4 times, the client should take a deep abdominal breath, bend forward, and cough 3 or 4 times upon exhalation. Lying flat does not enhance lung expansion. Sitting upright promotes full expansion of thorax. Shallow breathing does not facilitate removal of secretions, and forceful coughing promotes collapse of airways. A side-lying position does not allow for adequate chest expansion to promote deep breathing.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.